On this 24th day of March, Kenya has joined the world in marking World Tuberculosis Day. And today, there are two sets of good news on the treatment and prevention of the killer disease. The Kenya Medical Research Institute, that's KEMRI, says it is in advanced stages of not only reducing the treatment period from 6 to 4 months, but is also, I should say, conducting clinical trials in 2 TB vaccines. Lois Wangoi with that update.
Tuberculosis remains a top priority disease for the country, granted that TB is responsible for at least 6% of all deaths in the country.
TB remains a leading cause of death worldwide and is the 4th leading cause of death among infectious diseases in Kenya.
Receive treatment.
Global medical interventions say tuberculosis can almost be cured using a cocktail of antibiotics over a period of 6 months. In a statement to newsrooms Friday, KEMRI announced that Kenya is moving towards shortening this treatment further to a period of 4 months, and KEMRI hopes to support the National TB Control Program in rolling out this new treatment program.
Unfortunately, access to diagnosis and treatment is often limited, leaving many people without the care they need.
Besides shortening the treatment period, the other good news is that KEMRI is in the advanced stages of developing 2 TB vaccines: BCG recombinant for infants, that is in phase 2 of their clinical trials, and M72 candidate TB vaccine for adolescents and adults, that is in phase 2 trials.
Tunafanya mipangilio na hivi karibuni, miezi michache tu, tutawaeleza vile namna kulipa NHIF tutakuwa tumepunguza kutoka shilingi 500 hadi shilingi 300.
To have strong community involvement through volunteers and public health officers. They are critical in locating missed cases at grassroots, engaging in health education, and encouraging individuals who stop their treatment to continue with medication.
According to the latest statistics by the Ministry of Health, the country registered 77,854 new TB cases in 2021, while in the year 2022, the country registered 90,841 TB new cases. This significant rise in new TB infections is attributed to the COVID-19 pandemic disruptions alongside a prolonged electioneering period. Now, the government is mitigating that setback through
by offering free diagnosis, like today, and treatment to all TB clients, providing social protection to all drug-resistant TB patients by enrolling them for NHIF and providing them with monthly stipends.
But even then, health stakeholders and TB patients are faced with a daily challenge of stigma around the disease, which is often stereotypical, linked to HIV and AIDS. While these may not necessarily be the cause of TB, persons living with HIV are predisposed to tuberculosis owing to their compromised immunity. Lois Wangoi, NTV, in the county of Uasin Gishu.